Thanks for joining us for KSAT News at 9, streaming here in the KSAT 12 newsroom. I'm Courtney Friedman. Beginning tonight with the coronavirus crisis, Mayor Ron Neurenberg announcing tonight 168 positive cases of COVID-19 here in Bexar County. The city is also reporting 6 deaths now, 1 man and 5 women. According to Metro Health, 63 of our cases in the county have been travel related. 57 cases were spread through the community, and currently there are 42 patients in the hospital, 13 of them in intensive care, 11 on ventilators. And a new number tonight, Mayor Ron Neurenberg revealing 44 COVID-19 patients have made a full recovery. Around Texas, the Department of State Health Services is reporting more than 2,800 cases and 38 deaths. According to their data, more than 35,000 tests have been conducted statewide. Around the U.S., the Centers for Disease Control and Prevention reporting upwards of 140,000 cases with more than 2,400 deaths. The U.S. has surpassed Italy and China to lead the world with the most cases. A group of creative minds in the fields of medicine, math, computer software, and architecture are in a race against time trying to develop emergency ventilators. The goal is to make a simple and effective prototype that can be manufactured in San Antonio, quickly delivering to the local hospitals in just weeks. Patty Santos tells us they're ready to present and design to a hospital for emergency use review.
So this whole team is literally around the clock.
Drew Plassett with Can Opener Labs shows us the work that's been going on nonstop for a week at the office.
The original models were literally out of PVC.
A team which includes developers, doctors, and even District 1 councilman and architect Roberto Treviño have been all brainstorming on a simple, effective emergency use ventilator that could be made and used in San Antonio should there be a shortage in our hospitals.
The whole goal was to make it in a way that these could be rapidly made and rapidly deployed. So they're actually now water jet cut out of aluminum. They're made out of metal. They're actually some material stuff you'd get at it's all stuff that gets sourced locally.
I would call this our 5th prototype at this point. We've had it functioning model, several functioning models, and we're hopefully assembling this one and have it ready to work in a couple hours.
Can Opener Labs is a prototyping and development firm. The pandemic prompted them to shut down and volunteer to make medical-related products that are in need, like face shield masks and now ventilators.
There's good that comes out of all this hard times, and I think that's something that we can really show the amazing talent, amazing people we have here.
This is kind of the latest model.
You're still using the
show the motor. And there's the motor.
I don't know that yet. Oh, you have it?
So that's a simple system right there.
The prototype will be presented to the University Health System Institutional Review Board in the next few days. The group is also in talks with the FDA to seek emergency approval.
We will be presenting this in the hopes that we can find a path forward.
They say it only cost a few $100s to make. And you saw all of them working in that office, some of them sacrificing time away from their family, some of them even sleeping in that office, one because they work late hours, but also because they are group isolating. They say this is not the type of work that can be done remotely. For the 9, I'm Patty Santos.
Thank you, Patty. An 8-year-old boy is finally glad to be home tonight after spending over a month in the hospital. That boy, Elijah Belmares, was shot through the heart and several other organs in a drive-by shooting on the east side back in February. His grandmother says after 19 surgeries, they were finally able to come home today. She said that experience put their entire family on an emotional roller coaster.
See him laying in this bed, he went through all this pain, this hurt, this trauma. You know, and, well, we're not stopping, right? Right? We're gonna keep going? Yeah.
Tonight at 10, Elijah tells the night team's Jaffney Gray how excited he is to be home in time for his birthday. Now let's turn to the 9 at 9. Field Hospital set up in New York's Central Park. Macy's letting go more than half of its employees, and the 2020 Olympics in Tokyo have a new start date.
Here's tonight's 9 at 9. The USNS Comfort has arrived in New York Harbor. The hospital ship will treat patients who do not have COVID-19. It comes as the state's death toll tops 1,000 and officials work to brace a hospital system overwhelmed by the coronavirus. Also in New York, tents are set up in Central Park as the city converts part of the park into a field hospital. According to the mayor, it's expected to be up and running tomorrow. The 68-bed emergency hospital is designed as a respiratory care unit. The governor says he wants a 1,000-plus capacity temporary hospital in each borough, as well as Westchester, Rockland, Nassau, and Suffolk counties. The K. Bailey Hutchinson Convention Center will become the first overflow hospital in the state of Texas for COVID-19 patients. 250 beds will be set up with plenty of room to expand, according to Governor Greg Abbott. Officials with the National Guard said that could become as many as 1,400 beds if necessary. Atlanta police were trying to investigate a quadruple shooting Sunday night when they ran into a complication. One of the victims of the crime may have coronavirus. The victims told police a group of them were outside an apartment building when a black car drove up and someone inside the vehicle started shooting. Police say 4 men were shot. 3 other injured victims walked into the hospital on their own. In Madrid, they're building a temporary hospital at a big convention center there. Different pavilions will serve as hospitals to treat COVID-19 patients. Part of the temporary hospital will open this week. In total, they will have 1,400 beds and an ICU center. Formula One engine manufacturer Mercedes teamed up with clinicians and university engineers in London to design a breathing aid for coronavirus patients. The development could help reduce the need for ventilators. The team reverse engineered an off-patient CPAP device used to treat sleep apnea. They upgraded it and redesigned it for mass production. They did all of that in less than 100 hours. The new device has been recommended for use by the UK Medicines and Healthcare Products Regulatory Agency. Macy's says it will furlough a majority of its employees because of the coronavirus outbreak. The company says the furloughs will get underway this week, affecting more than half of its 125,000 workers. But Macy's says it plans to gradually rehire them when the business returns to normal. And the furloughed workers will be covered with the company's health care at least through May. A top German tennis official says a Wimbledon cancellation is already a done deal. Tournament organizers are set to meet Wednesday to officially decide whether to hold the event this year. But the vice president of the German Tennis Association says given all the travel restrictions, it's unrealistic to plan a tournament that involves hundreds of thousands of fans traveling across the globe. If Wimbledon is canceled, it would be the first time since World War II. The 2020 Olympics will happen in 2021. The global coronavirus pandemic forced the International Olympic Committee to delay the Games by a year. The summer event will still take place in Tokyo, Japan. Many competitors across numerous sports expressed concern that they would not be ready for the Games this summer. Training facilities have shut down and social distancing has made it difficult for many to get into peak condition. To read more about these stories, head to KSAT.com.
Well, hey everybody, welcome to my house. I'm meteorologist Sarah Spivey with a look ahead to the forecast. We've got some big changes in store, but first I want to go ahead and take a look at what happened today. So a lot of you know, even though we were stuck inside, that it was kind of dreary and drab outside. Our time lapse really captures that. You can see the rain droplets there on the tower cam. Now, today, the high temperature was only 75 degrees because of all of that cloud cover. And even though we did have areas of on and off again light rain, only 1/100th of an inch of rainfall was recorded at the airport today. Our morning low was much warmer than average because we've got high humidity in the air. But my hope is that even that little bit of rain will really help us out where the pollen count is concerned. Oak pollen is very high. In fact, it's the highest we've ever seen it, almost at 31,000 pollen grains per cubic meter of air. So again, I'm hopeful that some of the rain, even though we didn't get a lot of it, will help to reduce that oak count. By the way, oak season usually comes to an end by the beginning of May, but we really start to see it recede by the middle of April. So here's to hoping. Okay, let's go ahead and take a look at our weather setup. Across San Antonio, again, we had those areas of mist and drizzle and light rain, but just off to our west right now, there's a cold front. And behind that cold front, it's not necessarily going to be a lot colder, but what it is going to be is a lot drier. What I've done here is I've overlaid the dew points on this map, and you can really see the high humidity in that rich green color color. And then behind that front, very dry air moving into place. So let's take you through the futurecast. That front will arrive early tomorrow morning, socking out the humidity, really making for a dry day and allowing for total sunshine for your Tuesday. So Tuesday is going to be absolutely beautiful. In fact, we're gonna wake up near 58 degrees tomorrow morning. So if you do wanna get some outdoors time, it's gonna feel amazing tomorrow. Again, cool in the morning, mostly sunny skies all day, low humidity, and in the afternoon, really pleasant. A little on the warm side in the low 80s, but still really nice and pleasant. Comfortable in the evenings, but breezy with winds from the north at 10 to 20 miles per hour. Then we're gonna see a weather pattern shift by the end of the week. So no chance for rain tomorrow or on Wednesday, but by Thursday we start to see our rain chances tick up, and then Friday's our best chance for scattered showers and even a few potentially strong thunderstorms. It's still far off, so we'll have a look at that closer to Friday, but just wanted to put that on your radar, pun intended, that we are going to see some thunderstorms, especially on Friday, some of which could be on the stronger side. So we'll put it together all for you here in the 7-day forecast. Really nice the next couple of days. Humidity returns by Thursday when we see a small chance for rain, and then by Friday, thunderstorms will be around, and even into early next week, we're still going to carry a good chance for scattered showers and thunderstorms. So tomorrow, Wednesday, get outside, it's going to be nice. By the way, if you didn't catch it, I actually did a really fun weather trivia quiz that older kids can follow along with. It's on the KSAT website. It's going to be awesome, so just search weather trivia and KSAT and you will find that video. I know kids are cooped up inside, but again, that's the weather for now. I'm meteorologist Sarah Spivey.
Good to see you, Sarah. Thank you. We'll be back in 1 minute. Stay with us.
Fighting fear and fiction with facts. It's the goal of this segment on the News at 9, where we bring in experts to discuss the COVID-19 pandemic and ask them questions we have, and perhaps most important, questions you have, our viewers. Tonight we are joined by San Antonio Metro Health Director Dr. Don Emmerich. Thank you so much for joining us. First question I have is, what's your message to our viewers tonight?
Take a deep breath, just like I did, and follow the declaration that the mayor established, where social isolation or social distancing is the #1 priority for helping us not, to contain the spread of COVID-19. And the best way to do that is to mind all of the declaration, stay home. If you do have to go out and about for the grocery store or to get gas, or some of those other essential services, be sure to wash your hands. Make sure that you are coughing away from folks. Keep a strong distance away, a 6 foot distance away from everyone. And, and then just hunker down and stay home. The best way to contain COVID-19 is to eliminate any of the interaction with people. And so let's just stay home and just try to follow the rules of the declaration.
All right, let's get to some of our viewer questions. The first one, what qualifications does a person have to meet to be tested for COVID-19?
So there's the standard criteria of looking at symptoms. So the symptoms could be a fever, a slight fever of 99.6, shortness of breath, and a dry cough. So those are the things that people are going to look at. Your provider is going to ask you whether you have those symptoms or not. The provider will then make a recommendation of whether you are someone that should get tested. If the provider is not able to make those tests or to test you at that time, then you can call the 311 hotline number, and they will get you connected to being screened and registered for the drive-through testing site that's over at the Coliseum.
Are you looking at all at changing those qualifications at a certain point or making it easier to get a test?
Yeah, we are. And as the local health authority, I do have, along with getting perspectives of the experts in the community, we can tweak that criteria. So we can do that at any time, and we are absolutely looking at expanding that criteria as we speak.
How many tests, the next question it kind of feeds into this, so let's get it. How many tests are available right now, and do you know when we're going to get more tests? Does that help set the parameters at all for who gets tested and who doesn't?
It does at times. So in the very beginning, the entire country was really struggling with getting the supplies that every community needed. The testing is the testing kit requires the swabs, it requires the test tubes with the medium in it. And there was a shortage across the country of being able to have the appropriate testing kit. In addition to that, the labs also was having a shortage in what's called the reagents. And so you kind of have to have the reagents to kind of cook the specimens, if you will, to process the test. And those were in short supply. Now those things are really starting to come around. We have more and more people that are testing, more and more labs that are coming online to process these tests. So right now, if I were to give you a count of how much around our community we could do a day, it would be 1,000. At any time today, we could process 1,000 tests. We do have the pre-approval drive-through that's over at Freedom. That is happening right now. They have ample supply of tests. We also have some clinics. We have Texas Med Clinic that has 19 clinics around the city that are also providing tests. And then Communicare, which is our 2 FQHCs. Well, they have 2 FQHCs in town, federally qualified health centers that are also testing.
Yeah, that's all great news. We actually talked to Texas Med Clinic last week during this segment, so I'm glad that you pointed that out. Now, I want to compliment Metro Health. I know you've been getting some heat about numbers and things like that. The dashboard, as it stands today, is a great resource for everybody in the community.
Isn't it amazing?
Yeah, sanantonio.gov if you have any other questions. But one of these questions actually comes from that dashboard. Do you think there's a reason why one of the city's most affluent zip codes, 78209, has a larger amount of confirmed cases?
Yeah, such a great question. And whoever looked at that, you're very observant, and I appreciate the question. So I'm going to go backwards just a little bit. We know that those positive cases, of the 168 positive cases that we have, one of the things that our epidemiologists do is to identify whether they are travel-related cases, close contact cases, or community spread. The travel-related is what we are looking at in that affluent area. What we're noticing is that those positives that are in that area were from folks who traveled. What we also know, and we don't know this for sure, but it also is a part, we're doing a lot of work around our healthcare providers and our first responders. And intuitively, that is where a lot of our healthcare professionals live as well. So we think that it is, looking at the data, that a lot of those were travel related, which is associated with the more affluent you are, the more that you're able to travel internationally. So it makes sense to us, but let's not take our eye off the ball here. Yeah. There are clearly a lot of other positives around the community. We also know that we have a lot of work to do to make sure that all testing is available to everyone in our community.
Absolutely. I'm glad you brought that up. All right, next question. It seems men are more greatly affected by the virus than women. I'm not sure that's necessarily the case for Metro Health, because it seems like the deaths that we've seen have been more women than men. But why does it seem to be nationwide more men are greatly affected by the virus than women?
So if you have to kind of look at the longitudinal aspects of the general health between men and women, the difference of men and women. We know what to be true is that men do die earlier than women. Women tend to healthier in general than men. And so some of the higher chronic diseases that are associated with the behavior of men, the lifestyles of men. And so there's not necessarily a positive correlation to that. But we also know that coronavirus, if you have underlying conditions like chronic diseases, then the COVID-19 tends to place those folks more at risk. So it's not a strong correlation, but certainly there's an association. Now, here's the thing that's interesting. If that is indeed the case, what we're finding here, unfortunately, is the deaths that we have here in San Antonio, the majority of them are women.
Yeah.
So we don't have enough data to really make any type of inferences or conclusions at this time. I can also tell you that even the age range is not consistent with what we're seeing at the national level. We know that even those that are over 65 are more likely or more at risk for contracting COVID-19. However, our top age group for positive cases here is between 40 to 49.
Yeah. All right, next question. I love this question because there's a lot of concern that we're going to overstress our healthcare workers. This next question: should I still visit my doctor for non-coronavirus related issues, or should I use teledoc or telemedicine or whatever they're calling it?
You know, so I would talk to your individual provider. They will be able to tell you whether it is appropriate for you to come into their office. If your provider has telehealth, I would use it. If you have the ability to use telehealth, certainly use it. But unless your provider is telling you that you do not need to come into the office, just live life as normal. If you have any symptoms, however, if you feel like you're sick or you have any symptoms, please call ahead. Do not just show up for your appointment. Call ahead of time and make sure that it's okay to come in.
Yeah, and maybe have a mask with you if you're going into the doctor as well. All right, the last question. Are there extra measures we can take to prevent possible spread to those in our own home?
That's such a great question. So if you feel that you are doing something that could have exposed you, like, again, travel, if you've traveled to any of the domestic or within the United States, like New York, New Orleans, LA, Seattle, any of those cities that you may have frequented, or in coming back to San Antonio, then you may want to look at your doing a self-isolation. You can do that within your own home and still protect your family. You might have to be cooped up into your own bedroom, but if there's somewhere in your home that you can self-quarantine yourself and just make sure that you're monitoring your symptoms and not exposing your family, certainly that is something that you can do. You can also take your temperature twice a day and make sure that if anything goes above 99.6, then those might be indicators that you might have been exposed. If it's under 99.6, then more likely fine. But those are things that you can do from home.
Great. Dr. Dawn Emmerich, Director of Metro Health. I know you're very busy. I appreciate your time tonight, and thank you for directing us through this crisis that we're through. I appreciate your time.
You're very welcome. It's my pleasure. It's my pleasure.
All right. We'll be right back.
Here are some of today's top stories. The government is asking a judge not to let R. Kelly out of prison. Attorneys for the singer are seeking his release, saying he's at risk for coronavirus. But the government filed a motion today saying Kelly is a flight risk, and they say his risk of getting COVID-19 isn't unique. R. Kelly's attorneys argue his age and recent surgeries put him at a higher risk of infection while incarcerated. But the government notes no one at the Metropolitan Correctional Center in Chicago has tested positive for the virus. He's there awaiting trial for sexual abuse charges. Johnson & Johnson announced today it could test a coronavirus vaccine by September. The company announced a partnership with the Biomedical Advanced Research and Development Authority. They have committed $1 billion to fund vaccine research, development, and clinical testing as well. Officials think the first batch of vaccines could be ready by early next year. Johnson & Johnson says as the world's largest healthcare company, it feels a deep responsibility to use its resources to fight this pandemic. Oil prices are tanking on fears of an extended coronavirus lockdown. As of this morning, crude oil is hovering around $26 a barrel, lows that have not been seen in almost 2 decades. Prices are also suffering as demand collapses and the price war between Saudi Arabia and Russia drags on. Right now, U.S. oil is trading at $20.27 a barrel, down 5.8%. A $2 trillion economic stimulus package. Congress passed the package and President Donald Trump signed it Friday afternoon. It is the largest in the country's history. RJ Marquez breaks down what that means for you.
The stimulus package is designed to put money directly into Americans' pockets, but it will also help hospitals, businesses, and local governments that have been crippled by the pandemic. It is a massive bill. Here's a look at some of the key points. The package includes a one-time direct payment to Americans. One of the biggest questions being asked right now, who qualifies for these payments? Most Americans will get a stimulus check as long as they have a work-eligible Social Security number and meet the income requirements. The IRS will base the payments on a person's adjusted gross income on his or her 2018 tax return or their 2019 return if they have already filed. All Americans with an adjusted gross income below $75,000 or $150,000 for a married couple would receive the full amount of $1,200 per adult or $2,400 per married couple, plus $500 per dependent child. Americans who make between $75,000 and $99,000 or married couples making between $150,000 and $198,000 are eligible for a portion of the payment. The rebate amount for people in this category will be reduced by $5 for every $100 in income over $75,000 or $150,000 for a married couple. Okay, so let's do some of the math. For every $1,000 over $75,000, you're going to lose $50, meaning if you make $76,000 a year, your rebate check will be $1,150. The amount per child is not adjusted by income, but is only available to parents with income of $99,000 or less and married couples with income of $198,000 or less. If you make more than $99,000, you're not getting anything. Here are some other things to keep in mind. People with no income are also eligible for the same amounts. People who have been listed as a dependent on someone else's tax return, such as a teenager or young adult, are not eligible to receive a payment. So when can you expect your payment? Treasury Secretary Steven Mnuchin says that Americans can expect their checks in about 3 weeks, but some experts say that could take longer. People who have already set up direct deposit with the IRS could get their checks sooner. Others might have to wait weeks or even months to see their money because it will take the IRS longer to get the paper checks printed. For the 9, RJ Marquez.
The word unprecedented is often used to describe this pandemic. It's shuttered businesses and left many searching for a new way to make ends meet. Responding to this problem has been a challenge for local job agencies. One man who goes by Daryl is sharing his frustration.
It's a position Daryl has found himself in, looking for a way to cover expenses while trying to stay clear of COVID-19.
Yeah, this is definitely a critical service.
San Antonio's metro area is facing a projected unemployment rate of 12 to 14% for March. Many are flocking to Workforce Solutions Alamo for resources to help keep them afloat. But today, Daryl was unable to get in.
It's the most difficult time as you can imagine, to find a job.
But it wasn't a crowd of people that kept him from getting inside. Workforce Solutions Alamo has modified its operations to promote social distancing, so an appointment is now needed. It's a practice that went into effect on March 24th. Clients are being directed to call 210-224-HELP or go online.
Not everybody has access to the internet. I know my computer crashed and I haven't replaced it.
It's been a rush of people trying to get to resources, with some instances leading to at least one crash online earlier this month.
We're all going to try to use our smartphones and see if that works. And we're going to try it, off business hours.
So bottom line, Workforce Solutions Alamo is still open, but you may have to be persistent. We have the links and numbers you'll need posted online at KSAT.com.
What's up, guys? Time to check out some stories that are trending today on KSAT.com. And we start with Girl Scout cookies. Yeah, Girl Scout cookies. So now, Girl Scout cookies, because of the coronavirus pandemic, they are not allowing Girl Scouts to go door to door or sell booths at supermarkets or any type of stores like that. That all makes sense. So now you can order all your Girl Scout cookies online. Pretty cool, because you can just go on their website, order all your favorites, and you can actually get them sent to first responders, medical personnel, and a lot of people that are in the front line of this pandemic. So that's pretty cool stuff there. I must say, I always feel pressured into buying Girl Scout cookies. That never fails. But usually I'm pretty happy when they come in. So no complaints there. But if you want more information on this online program for Girl Scout cookies, go to KSAT.com. All right, switching gears a little bit here. Cardi B. I know a lot of people are wondering what Cardi B has been up to during the quarantine. Well, she's been showing some love to a San Antonio artist. So this San Antonio artist, his name is Colton Valentine. He posted, or he created a mural that's at the corner of San Pedro and Cypress Street, and it's a mural of Cardi B. And so he kind of updated it. So basically, he just put a mask over her face. And she thought this was pretty hilarious. She said that it was one of the coolest things she's ever seen. She says that it's amazing. She appreciates the love and that it makes her really happy. So there is your Cardi B update, quarantine update. If you want more information on her post or this artist, this is actually a pretty cool mural. Go to KSAT.com. All right, last story here. A lot of talk about the Tiger King. I had thought I was going to watch it over the weekend, but did not. So I'm still looking forward to that. But apparently a new development here. Carol Baskin, the big cat lady. She's one of the top, I guess, one of the stars of this show. She's actually from San Antonio. So this actually came out in Texas Monthly that she was born here. She was born at Lackland Air Force Base. And it even said on her Facebook page that she lists the Alamo City as her hometown. So pretty cool stuff there. You could go check out this article and learn more about Carol Baskin, because I know a lot of people are really interested in Tiger King right now and Joe Exotic and all the crazy stuff going on there. Now, just a warning, and I'm telling you right now, there are spoiler alerts in this article. So don't blame me, don't blame us, but there are spoiler alerts if you have not seen the series, the hit series on Netflix. So that is what is trending, guys. Make sure to stay safe, stay healthy out there, and I will see you guys later. Bye.
Thank you so much for watching the news at 9. Remember to take care of yourself, take care of your neighbors, and the night beat starts at 10.